Community water fluoridation in Kansas actually has about a 2-decade history. The United Methodist Health Ministry Fund from Hutchinson, Kansas, started in the late 90s, giving grants to cities and localities that wanted to fluoridate their water. And that had some real successes. The other, I think, in consequence of that was getting on the radar of a lot of anti-fluoridationists from around the nation. So Kansas has definitely had a checkered history of our successes and our losses with community water fluoridation.
Community water fluoridation is one of the top 10 public health measures that have ever been recognized, and it reaches the populations that need it the most. This is a proven way to help reduce caries in children. And one of the things fluoridated water is so important is because as children drink fluoridated water, the teeth that are forming in their mouths, their adult teeth, before they're even erupted into the mouth, that fluoride combines with the calcium in their system, and it creates a stronger, more resistant tooth to decay. So that's why systemic fluoride, drinking the water, is so important.
Population health really is literally what are the impacts on the health system that would influence the population. There are a number of current initiatives in public health that are looking at the environment and how we have opportunities to simply live healthier ways. So changing the ability of people to have access to stairs, for instance, rather than elevators. So fluoride is similar in many of those initiatives in that it becomes part of the world around us that is available to us without thinking about it, without reaching out for it, without having to intentionally go get it.
Health and Human Services and the CDC came out with the new recommended levels of fluoride adjustment for public water systems, and that is 0.7 parts per million. It's not really new information. It is a point that they have specified that this is the best point to try and reach. Kansas has already been doing that for quite some time. As a dental hygienist, I have the opportunity to go out to schools and do oral health screenings. And I've been to rural areas, I've been to urban areas, and there is really no difference when you go in and you see children that are in desperate need of dental health and they are suffering and they don't really have any access to care, but they do have access to water, and I think fluoridation is a really good way to meet the public in those areas.
Most recently in Kansas in 2012, the city of Wichita put community water fluoridation on the ballot. They are one of the largest cities in the United States that does not fluoridate their water. It was originally before the city council, and at the last second, they had a change of heart and decided to actually put it on the ballot. So that's where we ended up in a full-blown campaign in a very large city in a general election year.
Well, I was actually born and raised in Wichita, and I am a daughter of both a physician and a dental hygienist. We know that if you have areas of your body that are struggling to be healthy or have lots of inflammation, it really affects you as a whole. Fluoride is fantastic for a pediatrician because it reduces the chances of a child, both early in life and later in life, from having these inflammatory events. By not having cavities and other issues in their mouth, they can actually be healthier as a person.
That campaign lasted for 9 months, though, and in some ways, I think they were victims of their own success in reaching people. There was a lot of fluoride fatigue at the end of the day in Wichita, and unfortunately, that initiative did fail.
With the most recent election, it was very frustrating. We noticed this trend where outside interests were coming in and distributing really bad information and creating a sense of distrust of the local doctors and dentists. They created a very divisive community through the use of fear-mongering. I know the impact that this would have for children would be just so amazing. And I plan to continue on this issue for as long as my career goes on.
In 2014, the state legislature saw a bill, House Bill 2372, that would have required all local entities that fluoridate their water to put a statement on the bills going out to consumers that said that fluoridation lowers the IQ of children. This is a misrepresentation of the research that has been done on this topic. Oral Health Kansas organized a very strong opposition to that bill. We also found some fabulous champions in the legislature who were real heroes of public health, I think, at the end of the day.
We had extensive testimony from the advocates of oral health in Kansas, and it was very clear that that they were proponents of having fluoride in the water in Kansas, and I was certainly convinced.
All of the people who testified on that legislation were Kansans. They were people with an interest in making sure that their communities maintain and preserve the water fluoridation that they have. And so we were very pleased to see that the House Health and Human Services Committee actually killed that bill. We at the state level heard about what was going on in Salina. We'd kind of been watching the newspapers and knowing that there was a little bit of a dust-up starting. And so when they certified the petition that the anti-fluoridationists sent around, our first call was to a lot of the people in that community who are dental champions, and to people that we've worked with over our 10-plus year history.
So now at this point, it's not necessarily about education and advocacy, it's about how do you educate the voters? How do they get the information they need to make a decision on November 4th? And so everything we wanted had, keep it simple, keep fluoride, vote no. You didn't matter where you saw it, you knew what to do, and we wanted to stand out. So our signs, you could see them a mile away because they were bright yellow, and it was something that was simple to see how it blanketed the city there. We had obviously about a year difference between Wichita and Salina's ballot initiative, and I learned a lot about being prepared for when that happens. Who do I need to have on our side? What kind of things need to be involved? What relationships need to be in place? 13 weeks of the most challenging, intensive, hard work I've ever done in my life. And to be at our watch party that night with the people who were instrumental in that success, it was just really great to see that, we can make a change, and we were able to be effective in bringing together a community. It felt good to see our hard work pay off.
I think the biggest thing is realizing again the very small financial incentive or initiation and the huge cost savings overall for their community. And if we can save everyone on those dental costs, I think we're all going to be much happier and healthier citizens.
We really need to educate ourselves, not just on the technical, how fluoride is effective, how it works, but some of the research behind it. And we really need to understand what these anti-fluoride people are saying about it so we can respond to that.
Winning in Salina, I think, and winning with House Bill 2372 really is the beginning of a tide change in Kansas. I hope it is the first of many. I think that we have the relationships. I really think we have the coordination, and I think we have the passion. This is something that a silent majority of Kansans are for. This is something that we've seen for decades and generations of benefit with in the state of Kansas, and something that we intend to continue doing in this state with our statewide partners and with our local partners.